Are you coping COVID as a dental resident and having some challenges or making some adjustments? Stay tuned as we talk to a chief resident in a GPR program who's making some adjustments to be able to contribute to the COVID crisis. Stay tuned. Hi, this is Dr. Darwin, the New Dentist Coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, surviving dental school, and then also getting into and surviving residency. Today's topic is about residency amid the COVID-19 crisis. We're going to be talking with Chief Resident Dr. Garrison Copeland, who's in a unique situation as a Chief Resident and leading the GPR residency and dentists and dental residents who are contributing on the front lines of COVID-19. Dr. Copeland, how you doing, man?
Great, I'm doing great. How you doing, Dr. Hayes?
Good, man. Good to see you. For those of you that are tuning in for the first time, be sure to subscribe down here at New Dentist Coach podcast show at Dr. Darwin Speaks. Subscribe and also hit that bell notification so that you'll be the first to know when new videos are being released. So Dr. Copeland, tell us a little bit about yourself, just to kind of so everyone knows who you are and what your role is.
So again, my name is Dr. Garrison Copeland. I graduated Morehouse College 2006, Howard University 2010, and went on to Case Western Reserve for my orthodontic training and finished in 2012. Practiced for 6 years in Cleveland, went on to become a partner 3 years in to practicing with the same company, and then around 2018 decided to pursue a dual degree. So I looked at possibly doing pediatrics for a myriad of reasons. I actually did match, but for a myriad of reasons I chose not to accept the seat. Reached out to the wonderful people out in Bronxcare. They were kind enough to bring me in. I took on a year as a GPR to take a better look at pediatrics and see if that's really for me. Thankfully, because I did that, I realized that not necessarily was for me, but I really enjoy dentistry in general. I love dentistry. I love helping people, whether it's making someone smile or taking away the pain. It's all wonderful to me. So I have the honor of being named Chief Resident and staying on for a second year at Bronxcare Hospital. I've met some amazing people along the way between Dr. Hayes, Dr. Gates, our new Commander-in-Chief, Dr. Dowridge. It's been an awesome experience. So I've currently been in this general practice residency this is my second year, and I found myself in it during COVID-19. So that's what brings me here today.
Yeah, man, COVID-19 has thrown a little monkey wrench or a couple monkey wrenches.
A little bit.
Our most residents' traditional training, especially right now. So let's talk about it. So let's talk about how COVID has changed a little bit as far as any changes in the clinic. What's going on in the residency program right now?
So we're currently not treating any non-essential procedures, patients. So all we're taking on at this point are emergency patients, for example, patients that come in pain. We do take on small emergencies, for example, if a temp falls out or something like that, but for the most part, it's managing pain, it's managing infection. Normally our clinic will see about 100 patients, maybe a little bit more a day. We're down to about 10 to 15 patients per day at this point. And again, it's just all managing pain.
Now, is that in both the main clinic and also the satellite clinics, about 10, 15 per day? Or is that total for all the clinics?
So those who aren't familiar with Bronxcare, we do have the main clinic at 1775. That is in the main clinic. For the satellite clinics, and we do have offices all throughout the Bronx, they may be seeing more like 2 or 3 emergency patients a day. They're slightly smaller. But again, it's what the community needs. We are here for you.
Gotcha. So mainly you guys are just like all the other dental practitioners and offices and centers and departments are just treating the emergency procedures as well.
Absolutely.
So what is it like as far as having to upgrade or manage with the PPE?
It's an upgrade. I'm wearing a hair bonnet. I'm wearing a shield. I've got an N95 on top of a medical mask. Well, the medical mask is in front of the N95. Obviously I'm gowned up, and I have the bunnies as well. So.
Gotcha. Yeah, that's something that's definitely going to be key as we continue through this period of time, making sure there's enough PPP, not only in the hospital setting, but in the hospital setting as relates to the dental department too. Unfortunately, we as dentists, hygienists, oral surgeons, any dental professional that's generating aerosol with a handpiece, we're at the highest risk of all of this, man. And hopefully we continue to be mindful of the importance of PPE with the N95 mask, face shield, the blue little hoodies I used to wear, the little hair bonnets and everything, and all the rest of the necessary PPE. So any changes in your role as chief resident? I know you have some specific duties and responsibilities, but how has that changed with COVID-19?
Well, one of the benefits of taking on a chief residency role in the hospital is that I get to put together my own schedule. And obviously with the pandemic at hand, you do not get that anymore. So at this point, we are here to help. So the schedule has been laid out for us by our directors. We are following orders as necessary to make sure that we can efficiently take care of those who are truly in need at a time like this. So, for example, my week would consist of oral surgery on Mondays. Tuesdays would be general dentistry on the main clinic floor in the hospital. Wednesday and Thursdays, I get to go to satellite. Satellites offer me the opportunity to follow more cases, manage more of my cosmetic cases. That's really one of the major reasons why I took on a second year, is to take on as many cosmetic cases as possible, because I'm hoping to blend orthodontics and cosmetics in the future. And then Fridays, I just try to help out in the orthodontic clinic. So any residents that have questions, what to expect about a case, anything like that, that's what I did. All that's out the window. So last week, I was on chief duties all week, and I managed the schedule. I made sure everybody's where they needed to be, and I supported the emergency clinic.
Okay. Gotcha. So on a week that you're typically not on chief duties, are you helping out in other parts of the hospital as well? Like what's been your experience for some of your non-chief duty daily duties that you would have throughout a typical week?
No, yeah, that's exactly right. I help out in the hospital. So I help out in one of the satellite clinics. So for example, next week I'll be at MLK, and I'll just help them with their emergencies.
Mm-hmm. Good. I know here in New Jersey, what's happening is, in addition to dentists being requested to turn in PPE and share PPE across the board, in addition to seeing emergencies and being open for emergencies in their offices, so that patients don't flood the emergency rooms at hospitals. Some dentists are actually taking it up a notch and actually starting to volunteer as healthcare personnel that are doing the COVID specific testing and helping out. And I mentioned earlier when we were talking that you had mentioned that you've been helping out in one of the hospital departments. Tell us a little bit about that experience.
Absolutely. It's been a very unique experience. So roughly 3, maybe 4 weeks ago, 30% of the doctors in family medicine department in our hospital became ill.
Wow.
And the chair of the Department of Family Medicine and Internal Medicine reached out for volunteers. And they asked within the hospital, are any of the doctors willing to volunteer to help? Because, we're in a lot of trouble. So with it all being said, it happened on a Friday. I was one of the volunteers. Initially, there were 10 of us. We were not given a lot of information as to what we would be doing, what to expect, but we knew it was going to be a very dangerous situation. So that same Friday afternoon, we went over to the hospital and we sat down with the directors of internal medicine and family medicine. And they basically explained to us, you had 2 options. You can help us out on the telemedicine side, because as you know, patients cannot go in and visit their loved ones who are COVID positive. So you need to be the doctor on the other end of the line, walking patients through what's going on, updating them, as well as those patients who are calling in who think they may have it. So I give special credit to my colleagues there were 8 of them who took that role on, manning the phones, managing patients in that manner. 2 of us, myself and Dr. Singh, we decided that we wanted to do bedside direct patient contact care of COVID patients. It was a very humbling experience, because as you can imagine, what do I know about what goes on the family medicine floor? I'm an orthodontist who's now taking on the GPR. So again, we weren't given a lot of information that day, but we knew we started Monday. And I was actually the first to go in. And ultimately, the main thing that I did, and I give special credit again to the attendings and residents on the family medicine floor for being kind enough to walk me through some things of, this is how you can help us, this is how you can improve patient care, so you can free us up to make sure that we're doing the best that we can for each and every patient. I tested every new patient that was admitted to the floor for the coronavirus.
Wow.
I also administered the influenza, the flu test as well. And then after that, you take off your dental hat, you take off your orthodontic hat, and you just help any way you can. I played many different roles on that floor, from running to get medication to transporting patients, anything you do, monitoring vitals, pulse ox, those things, anything they needed, that's what I did. Because as you can imagine, there's a lot of people who are getting sick, helping those who are sick. So I took that on for 2 weeks, and I got called back because I'm the chief to do more chief duties the following week.
Good. Well, that's remarkable. We applaud you, man, because it's often thought that dentists are not doctors and doctors are different than dentists, and when it comes down to it, we all are helpful and our colleagues across the different specialties. And the fact that dentists are also on the front line at the hospitals, not just in their own private practices or health centers, but are actually at the hospitals on the front line helping their medical colleagues with testing, especially since this is our area, right? Helping with testing is phenomenal. So we applaud you, man. We appreciate all that you've been doing, and the rest of the team at Bronxcare, the dental department team at Bronxcare, because it's helping and it's saving lives, and it's another set of manpower, women power on the front lines that's essential and very needed. So appreciate you sharing that with us, and stay safe as well.
Absolutely.
That's key. So last question is advice. Any advice for incoming residents? As you know, we're probably about 2 months away from the change of the group, of the residency group, when those that have been in residency are getting ready to finish up at the end of June. And then July 1st starts the new, potentially new set of residents that are coming in. We all probably are expecting that COVID will still be around in July. Any tips, any advice for those incoming residents into this space?
Be open to what's to come, because like you said, we don't know when we're going to get to the other side of this. So for example, this week, aiding in the emergency department, I did a pulpectomy on a patient. Now, fortunately for me, it takes me about 10-15 minutes, but I can tell you my first year in GPR program, the first couple of months, it probably took me about an hour or two. So you may be in a room with an asymptomatic carrier for an hour or two. So with it all being said, know how to open up a tooth, know how to access the canals, know how to make sure that you're protecting yourself and your assistant, know how to still manage the room. The patient that I did that on was a 16-year-old little girl with her dad in the corner, and I was able to keep them calm, keep my assistant calm, protect everybody, and get this done relatively quickly. So be open to making the most of what's going to be put in front of you. And whether you like endo or you don't like endo, you're probably going to see a lot of that. Whether you like extracting teeth or you don't like extracting teeth, you're probably going to be doing a lot of that. Managing abscesses, things of that nature. That might be a heavy part of your first experience in residency, but go in all the way and make sure you have that part down, because there is so much to dentistry, but you want to take it in bits and pieces.
Right.
So that's the key to walking into a program. I hope that each and every one of you get a complete experience. I hope you all have a great year. I hope you get out of it what you want to, but initially that's what you're going to see. It's going to be very honest with you.
Yeah, and so it sounds like there's going to be a lot of still managing of emergencies, whether there be some extractions, pulpotomies, there might be some scripts involved, just helping people get out of pain and stay out of pain. And in addition to that, the medicine side or the medical side, which is usually one of the reasons why a lot of people choose the hospital-based dentistry training, and you'll have a little bit more, maybe even a sooner experience due to COVID-19. And so that's some great advice, man. So for those of you who are listening, thanks so much. Dr. Copeland, thanks so much. If you guys have questions for Dr. Copeland, you want to get in contact with me, shoot him an email. Actually, shoot me an email and I'll forward it to him. Shoot me an email right here at NewDentistCoach@gmail.com, NewDentistCoach@gmail.com. That way I can shoot it over to him. Dr. Copeland, if there are people that want to get in contact with you, what's the best way?
Via email.
Email.
Yeah, so go ahead and contact Dr. Hayes and he'll shoot it over to me. I'll be happy to answer any more questions that you guys have.
That sounds good, man. We appreciate it. We appreciate it. All right, guys. So you guys make sure you check out this next video right here. Dr. Copeland, thanks so much. And keep in touch and stay safe. Stay safe.